All right, so we are live, and good evening to the Children with Diabetes community. It's nice to have you here on a Sunday night. My name is Carrie Sparling, and I'm CWD's editorial director. I've been living with type 1 diabetes for 34 years, and I am excited to be tonight's host of our Screenside chat. And so before we get started, I just wanted to let everyone know at home that as we're having this discussion, you can post any questions that you have or comments either through the Q&A feature or in the live chat, and we'll answer those real time. And we're excited to connect with everybody at home. But this evening, we're going to be connecting with 3 people from the International Diabetes Federation's Young Leaders program. And I'm going to actually have our participants do a quick introduction, and then we have a short video to run. But everyone here on the call, can you say hi and introduce yourselves? And Nurian, if you don't mind starting, that would be great.
Sure. Thank you so much for this opportunity and invitation. I'm Nurian from Aruba. I joined the Young Leader in Diabetes program in 2019. So I'm very happy to be here and share how I've experienced this program so far. So I'm very excited to do this today.
Thank you for being here. And I'm just going to go clockwise for myself. So Kyle, could you go next, please?
Sure. Hello, everyone. My name is Jacques Rose. I am on the IDF board in the role of Vice President Non-Healthcare, and I chair the working group that oversees youth activities, including the Young Leaders program, since December 2019. I've been living with diabetes for nearly 25 years.
I've still got you beat. And we'll go on to Dr. Gomber, if you could introduce yourself as well.
Thank you so much, Gary. Hi, everyone. I'm Apurva, and I'm originally from India, and I'm currently logging in from Boston. So I've been living with type 1 diabetes for the past 13 years now, but I'm also a trained physician, and I was seeing patients in India, but right now I'm doing my master's in public health from the Harvard T. H. Chan School of Public Health. So nice to be here.
And I'm so glad that you have all joined us for the evening. And so my first big technical hurdle, other than starting the webinar, the second one now is going to be running this video. So Kyle, I know you have it on your computer, but if you don't mind, I'm going to try to run it from mine, hoping the sound's going to work, but just give me a second, everybody at home, so I can get this started up. So one quick second while I get to this. And my fellow panelists, if you don't mind just giving me a good nod once this starts and letting me know you can hear the sound, that would be fantastic. But we'll run this quick video and then we'll get back to the chat and we'll take some questions and have a good discussion. Ready?
Sounds good.
All right, here we go.
Hello, everyone. Thank you for joining today's session. My name is Jacques Rose. First and foremost, I'd like to thank the Children with Diabetes organization for including us in their Screenside chat series. It's been exciting to watch the series develop over the course of the last year, and we're honored to be included. Today I'll be talking to you about the IDF Young Leaders with Diabetes program, but wanted to start with a brief personal introduction. Those of you who know me may be aware that I am a dual citizen. With a British father and a French mother, I grew up back and forth between Europe and the US. As such, it's no surprise that I got involved in international work fairly early on. But it was actually through my member associations around me that I first began working in diabetes advocacy, the Fédération Française des Diabétiques in the Rhône-Alpes region, and the American Diabetes Association, who I continue to volunteer for in the California region where I reside. My formal role at IDF is Vice President, Board of Directors. I was elected in December of 2019. Before that, I was on the board of directors for the European region for 4 years. But I also have a number of other hats that I wear within the diabetes space that I thought were worth mentioning. I contribute to the Diabetes Wise project, a project that is funded by the Helmsley Charitable Trust. It's led by Dr. Corey Hood at Stanford University, and Corey and his team are striving to increase awareness and accessibility to diabetes medical devices through innovative ways, which I encourage you to take a look at. The website is diabeteswise.org. I'm also privileged to be on the Patient Advisory Committee for Inodia Project, a project that's tackling the immunological side of type 1 diabetes and led by Dr. Chantal Mathieu in Belgium. I continue to lecture and research through my appointment at INSEAD, And I've also listed a number of my former initiatives within the startup world of diabetes and elsewhere below. My sugar certainly holds a special place in my heart, as I spent a better part of the last decade at this startup and got to meet amazing folks and work with amazing folks like Scott Johnson, who I know is a member of the CWD faculty and well loved in this audience. A few personal disclosures, and I'll jump right into it. International Diabetes Federation is exactly that, a federation of member associations, over 240 of them to be exact, covering 170 countries and territories. This is managed through 7 regional offices. And I thought it was worth mentioning because in my experience, living both in the US and in Europe, there was much less of an awareness in North America, particularly in the US. That was my experience at least, so I thought it could be helpful to, at the very least, talk through the structure of the organization. This slide illustrates how those regions are split up. It also illustrates prevalence data from the IDF Diabetes Atlas, which is published every 2 years with an interim report done yearly. The statistics are staggering, but also show an important disparity across the world. Since I'm speaking to you from the States, I thought it would make sense to also look at our local region here, North America and the Caribbean. This is chaired by Dr. Tim Dorr at IDF. He is our chair for this region and sits on the board of directors with me. He also sits on the working group focused on youth activities, a physician living in St. Lucia. Not only is the list of countries long, the list of member associations from these countries is even longer. And for me, it's really exciting to see all of these organizations working across borders together with the goal of helping people with diabetes. You'll see a few names that you recognize, of course, probably like the American Diabetes Association. But today we'll also get to hear from someone who has worked at the Fundación Diabetes of Aruba. One of the YLD participants and members will be sharing her experiences during the Q&A. I won't focus too much on the vision and mission of IDF, as these are formally listed in documentation and our websites, but I did want to talk about our focus areas. Number 1, we want to raise awareness and promote prevention. We want to provide quality diabetes education to areas in need. And we want to increase access to quality essential diabetes medicine, supplies, and diagnostics. As part of that, we want to elevate the issue of diabetes to the policymakers, onto the global and national political agendas. And we can get there by strengthening and expanding IDF partnerships and networks through transparent governance. But as this group knows all too well, diabetes isn't just about these statements, these visions, and these numbers of prevalence. It's about people. And what better way to show than to let you hear from some of the people in our YLD program over the years.
My hope for diabetes would be that people can live with diabetes.
It's a purpose that we should all work hard for it. Every person deserves the rights to have access to medication.
So the complications and comorbidities with diabetes are inherent, and there are a lot of problems out there on a population level.
The doctor told me when I diagnosed, 5 years you will lost your eyes, 10 years you will lost your kidney. If you don't control your blood sugar, that will happen to everybody.
What we need to do is obviously be proactive with diabetes and not reactive to diabetes.
We're not only just the amputation capital of the world, Because of diabetes, we have the highest rate of death after amputation.
Now the number of the diabetes in China, the number is growing up.
60% of our population is living under $2 a day. The lowest rate of a while is around $7. Including that, the cost of the syringes, the cost of the testing and everything. Most people won't even have food to eat after taking their insulin.
For us, we need everything. It means that Africa, we just want to start from the grassroots level, going up. So it's just a matter of putting things on the table, and we get what needs to be done.
Right now, Blueprint Barbados is focusing on a lot of type 2 related projects and just diabetes related projects in general. I speak wherever I can, schools, hospitals, conferences.
We'll be setting up the first ever camp for children with diabetes in Pakistan, along with their families in March.
People talk about the change that you want to see in the world, and I believe as us as the young leaders, we are that change that needs to happen in the world of diabetes.
The video you just saw is from YLD participants and members from a few years ago, so the titles and their positions were relevant to them at the time and may no longer be the case. But you perhaps may have recognized a few names and a few faces. These individuals were already doing amazing work within their respective communities around the world and continue to do so today. I'm constantly impressed by the work they're doing in their projects. This video is particularly emotional because we hear from a young individual from Gambia, Lamin, who regrettably passed away in April of last year. A stark reminder of how difficult it can be to live with diabetes in certain parts of the world and in certain settings. Lamin was an incredible ambassador for the diabetes cause and will never be forgotten in the YLD community and the global diabetes community. But many of these statistics and harsh details are the reality, which is why we believe the YLD program is so important to create our next generation of leaders, advocates, and community members. Before we go into details of the YLD program, I'd like to just share with you some of the other programs at IDF. I won't spend much time on them and encourage you to take a look at the IDF website to learn more. The IDF School of Diabetes is an online training program that you can enroll for, and there are scholarships available. The goal is to train 1 million healthcare professionals by 2023. The focus is on nurses, but other healthcare professions are also very welcome to enroll. The kids program is one we feel particularly emotional about when we think about the school environment for very young children who have basic needs for diabetes that perhaps are not being met. Thanks to this program, some of those are being helped, particularly in developing countries all around the world. As far as conferences, we're known for a World Diabetes Conference, which happens every 2 years. That's been disrupted with the COVID-19 pandemic, and we will be announcing changes to that shortly. The last conference was in Busan, Korea, and the next conference will most likely be taking place next year. World Diabetes Day is an opportunity for all of us in the diabetes community to unite. The blue circle, we believe, is something that belongs to the people with diabetes. It may have been created and fostered and generated by International Diabetes Federation, but it belongs to the people with diabetes. And World Diabetes Day 14th of November is one we use as an opportunity to unite. In addition to other educational initiatives, we also have our disaster and emergency task forces. This couldn't be more relevant given what's going on. They make diabetes management a priority during disasters and emergencies, such as what we are going through with the COVID-19 pandemic, and we're working with organizations across the world to address this. Life for a Child is a former program of IDF that's led by Graham Ogle. Professor Ogle is an endocrinologist who lives in Australia, and his organization is doing wonders to make insulin and glucose monitoring supplies accessible, as well as care to young children throughout the world who would otherwise not have access to it. Again, I'm not going to go into the details. We work within global frameworks and national policies to create advocates through some of our programs listed here, as well as campaigns such as the Universal Health Coverage. The Atlas, which you see featured on the left, I've already discussed. And we work together with some of the largest organizations influencing health. But YLD fits right into that, and I look forward to going into details with you over the next 30 to 40 minutes, what YLD is, and how perhaps you can get involved. Thank you for your time, and I look forward to the Q&A session. Oh, I almost forgot. We've been going through some rough times, and somehow my kiddo has helped bring some smiles. Little Aaron Ali was born right at the beginning of the pandemic and has given us a lot of smiles despite the discouraging times around us. So I thought I would share a few of these personal pictures with you before we went into the Q&A. Thank you for your interest, and let's jump into the Q&A.
Can you hear me now? There we go. Okay, Kyle, thank you for, and I know you and I discussed prior to this broadcast that your internet was not supportive of broadcasting that video and doing that live. So thank you for pre-recording that. I appreciate it. And so now we can get into the question side of things if everyone's ready and willing for that. And again, a reminder to the attendees that if you have some questions, feel free to pop those into the chat. I'll be monitoring the chat and the Q&A so I can make sure that those are presented to the panel live. But just to start, so how does the Young Leaders program work? I don't know who wants to grab that one first. You'll all have to unmute eventually.
Well, if you want, I can start that.
Please.
Yeah. So, now to most of the people who are watching this, I'm originally from India. So I was diagnosed with type 1 diabetes at the age of 13. And I come from a family of doctors, and I had seen that there were people getting diagnosed with type 1 diabetes, but nobody was talking about it. So I was in need for a support system, something I wanted to make a difference in. And I was in search for an organization or a program about type 1 diabetes. So I think that's how I started searching about the Young Leaders program. So it was not like, you guys are really fortunate that you're getting a presentation right on your laptops about the Young Leaders program. But when I was diagnosed, it took me way too long to actually identify an organization where I could make a difference. So I searched about the Young Leaders programs, almost saw this exact same video which you guys are watching today. And that video really inspired me to reach out to IDF directly. Like, I wrote an email and I found out about the program. And then I went to my regional IDF organizations. So for example, like Kyle just showed on his video, that there are a lot of regional organizations who partner with the IDF. These are country level organizations. So similarly, I had Diabetes Association of India and another organization called the Research Society in India. I reached out to them about the program. So the Young Leaders program basically selects advocates who want to make a difference in the community for type 1 diabetes or type 2 diabetes by building up a project. So I I was in search to identify what I really want to do. And I just applied to the program. And so I was selected from my country. And it was one of the biggest inspiration for me to like be one of those people who got selected. And I had no project in mind. So like it was just that I wanted to make a difference. And because I was in medical school, like learning to make a difference and in search for more people living with type 1 diabetes in India, I applied to the program. And the program really gave me that platform, and it helped me build up a project that after 2 years into the program, when I first stepped in and like got really inspired by watching the video and then being in person there, listening to Kyle in 2017, first time face to face, I was so moved that I built up my own project of setting up a young youth-centric camp in India where we had like 500 children living with type 1 diabetes who had no idea that type 1 really existed in India, together on one platform. So that's what Young Leaders gave me. So that gift which I got from Young Leaders, I like now I'm here sitting with you guys, giving back so that you guys can make a difference by speaking to your regional organizations and partnering with them, and then being a part of the Young Leaders program. Yeah.
So oftentimes through Zoom, people's exuberance and excitement and emotion doesn't often convey, and yours absolutely did. So I found myself nodding along, excited as you told your story. So it sounds very, watching that video, I saw so many familiar faces, people that I've seen go on to tackle some really big advocacy projects in the diabetes community. And it's clear that this is a great community and launching point for people looking to make a difference. So I loved hearing your story. Thank you for sharing that. And Nurian, did you have anything you wanted to add to that? Or to tell
I believe Apurva, thank you, Carrie, so much. I believe Apurva, she said it with such enthusiasm, and it was beautifully said. It's about really trying to make that difference when you are in that situation and that position at that time, especially in the beginning. It doesn't matter in what situation you are going to feel lost in the first days or weeks. It's confusing, and it's not easy to have a diagnosis in the first days. But after some time, and you really feel that you want to make that difference and move forward, it's beautiful to have peers, other people that relate to you and how you feel and what you go through. And maybe it's not the same situation or country, because of course we all have different contexts, and in my island it's completely different than in India, for example. But you do feel at a certain level of connection and understanding, and that's something that this program provides us with. There's someone on the other side of the world that is maybe just pending for a message like, hey, maybe I can learn this from you, or how are you feeling today? I've been having a low, I've been having a high, and you understand each other on that level. And that's something that it's difficult to compare in another context, and that's something that this program really provided us with, that power that we need from each other.
And as you are both talking, we're getting a lot of questions rolling in about the specifics of application. So Kyle, if I could grab your ear for just a second in terms of talking about YLD, and the questions that we're getting are, if I'm interested in becoming a young leader, how do I go about applying? What are the requirements to apply? What is the age range? How many people can be involved? How long does it last? So are you willing to tackle some of those technical questions?
Yeah, absolutely. Thanks, Carrie, and thanks, Nurian and Apurva, for telling and sharing your own experiences. The application is such that we encourage applicants to work with our member organizations. So you would have seen on one of the slides I presented the member organizations in the North American and Caribbean region. In the US, the American Diabetes Association is the member association. And the reason that we encourage that is because of what I discussed in the video, is that really we are a federation of our member associations. And so by working together with your member association, it's the best path. So I think that covers that question. And in terms of range of age, we've actually varied over the last 10 years of the program from 18 years old to 25 to now 18 to 30 years old. And so we're a little different than, perhaps some of the programs that exist, certainly for children and very young people around camps with diabetes. And we really try to make that differentiation as far as leadership training and really creating the next generation of leaders. And I would love for for that perhaps to be something we can talk about a bit later in the Q&A, because I know that we have some nice examples to hear about that. And quite frankly, I think that given this is a CWD session, much of what CWD has created has been an absolute model for IDF to mirror as best as we can in some of that leadership type training that I've seen as done as counselors in training or otherwise for your bigger events.
Oh, I know Jeff and Laura aren't on this chat, but I'll say thank you for them, because that is very kind of you to say. And it's always good to see diabetes organizations working in partnership with one another, as you had mentioned, to create and help foster that next generation of leaders. So we're proud to be working alongside of people like you and your group. So thank you for that nod. And then, so in terms of kind of jumping into the actual experience of being part of this group, what, for you personally, what would you cite as your driving force for wanting to get involved? And Nurian, I might ask you to answer first, if that's okay.
Yes, of course. Before I get to the answer, I just wanted to acknowledge two YLD members are joining today. I'm very happy to see that they're supporting. So thank you for watching and for the support. Well, the driving force actually, when I was diagnosed, I was just imagining the same day. I was thinking about, what am I going to do with this? Because I didn't want to be sad for a long time. We all go through that process. So I was really thinking about how am I moving forward. I was finishing my internship and I wanted to help other people. And when I thought about children and youngsters not having the support or the tools or the knowledge about how you deal with your diagnosis and diabetes in general, thought this is something I wanted to do. And I started speaking at different events. Before I joined YLD already, I was really trying to do nice activities. I was invited to speak at certain activities already. And after that, I never wanted to stop. And then the opportunity to join YLD, it was a very random opportunity because I've been wanting to join. And when I got this opportunity, I didn't even think about it twice. I wanted to apply right away because this was a once in a lifetime opportunity that I had and I've been waiting for. So it's always thinking about the other being that voice and that ear, that shoulder people can lean on. And that's something that I wanted to provide for other people, as well as I wanted for myself. When maybe I felt that not everybody could understand. And when I was introduced to this huge opportunity of other peers that understand and you relate to, that driving force, it became a passion and it became my fuel as well to organize projects, to come up with projects on social media, and now with the situation. It's something that I cannot even explain how it really feels like. It's something that it's part of you when you really have that passion and love to do it. And that never changed ever. And not less now with YLD, it's become more and more with the time.
Sorry, I was muted. Absolutely. And thank you for sharing that. And Dr. Gomber, did you want to add to that?
Yeah, definitely. I think like Nurian explained her driving force, my story was like, when I look back to my story of what drove me into this path, and I'm still following it and I want to continue following it, because when I was diagnosed, coming from a developing country like India, where people had this stigma which was attached to a chronic disease, just like anybody else, I was told to hide my disease for quite a long time. And I felt like really trapped and isolated. And over the years, when I realized that I need to make a difference, I need to change this scenario in my country. And that's what really drove me to really search for organizations who are training people to like empower others to make a difference in their own life. Because when you apply to a program, you kind of like not just inspire others, but also kind of like learn so many new things in your own personal life. So my driving force was to fight that stigma and fight that, like to find more people living with type 1 diabetes. A lot of people in India do not share their disease, and that's one of the reasons why they land up in complications because of type 1 diabetes. And then that adds to the morbidity and mortality of the condition. So when I was looking for these things, and I knew that I wanted to become a doctor, I was looking for a driving force that what should I do? Like, I don't want to be a doctor just sitting and seeing patients, but I want to do I want to make a difference. Like that's what intrigued me to look into global organizations. And I found about International Diabetes Federation. And I was like, I should really apply for this because this will give me a direction, give me a path to actually identify how I can really make a difference. So I had the ideas, I had passion, but I didn't have the whole the toolkit to actually make a difference. So I think when I applied to IDF, they gave me that toolkit, the resources to actually plan my project and make a difference. And I think so, as Kyle just shared in his video, when you see those flags in one room, like all on one wall, that's really moved me. Like that was my first time stepping out of my country into a room full of flags from people representing across the globe with similar challenges of type 1 diabetes, connecting you together. And then you realize you're not alone and you have to make a difference. You have to change this because there are so many people who are living with type 1 diabetes, not just in India, but so many other countries who do not have access or privilege what you got to be here. So you give back to the community because you got that opportunity to represent. So I think that was my driving force. And when I went into that room, I knew I would come back with a very substantial project. And I built up the project from 2017 to 2019 of setting up youth-centric camps in India, which I described about in the beginning, that India never had diabetes camps. Like there wasn't, because there's so much stigma about the disease. So they never had like any kind of camps because people were scared to even share about their diagnosis. So rest alone, they would actually come for a camp. So we wanted to change that scenario. And I, with my organization, we worked along together to remove that stigma about type 1 diabetes, make people inspired that, hey, that it's okay. There are so many other people who are living with type 1 diabetes. Come along, let's learn it together. So in 2017, we built up the program, and 2019 was my first type 1 diabetes camp, where 200 people living with type 1 diabetes came in one ground. We had like doctors presenting about how to live with diabetes, what it is, why are we fighting for numbers, how you can inspire others, and why it is so important to achieve targets so that you can have a near normal life. So I think that was first camp, which inspired so many people. And we started WhatsApp groups from a time in 2015 where nobody, like we hardly knew people living with type 1 diabetes. We built up a community of 500 people across India, like just because I was in Delhi, which was the capital city. Our camp was only located in Delhi. So, but we had people joining us from very rural, remote areas, connecting with us on WhatsApp groups that, hey, we want to be in this camp. How do we come along? Do you like charge anything? But we didn't charge them anything. We just wanted people to just hop on and come. So that program really like set up this movement that today, when you go to India, you will see that the type 1 community has built up so well. Everybody, whichever state you go. So India is like a nations in nations because it's huge with a population of 1.4 billion. So now wherever which state you go, you just put on the WhatsApp group, hey, I'm a type 1 diabetic, I'm visiting this particular state. You would definitely have somebody to have coffee with in that particular state. So it's growing that strong. So that started in 2017, and now the whole project has really inspired so many people. There are more people, young advocates coming up who want to be a part of Young Leaders program, who are reaching out to their regional organization that, hey, I want to do something for this community. And so Young Leaders program would actually give you that toolkit and resources. You just follow your passion, and that's how it drove me to here. And I would like to continue contributing in the lives of people with type 1 diabetes. So today I am in Boston learning about global health so I can make a difference in amalgamating challenges which people are facing with diabetes globally and move ahead from there. So you've got the opportunity here. So just grab it and go.
What I'm hearing repeatedly is community, and it doesn't seem limited to somebody's geography. It seems you know, people with diabetes want to find their peers and want to unite and grow with their community. And it's great to hear everybody mentioning that so far, because as CWD and as a personal person with diabetes, community is such a big thing for people who are living with this condition. And so Kyle, I was watching you nod along too, so you're not off the hook. What brought you into the fold? Your personal driving
I think
force.
that, well, I really feel, and I've heard it used before, so I'm going to steal the expression that I'm standing on the shoulder of giants. And this program, you know, was very much in existence before I took my current role at IDF. Thanks to people like Paul Madden and others who had, at least in the most recent wave, which started in 2011, put together a very robust program. And so I feel like it's been very natural for me to come into a program which I already felt so strongly about. And the reason I wanted to show the video that I did was the YLD participants and members that had been part of the program in those years leading up 2015, 2017, before I got more involved, I think were one of the big reasons for the success of the program. The participants are so energized and enthusiastic to make a difference in their communities. They already are doing amazing things before they come to the program, and then hopefully with by bringing people together, as we know, we can be even stronger. And so I feel very privileged to be in the position that I am, and hope we can continue the program and make it even bigger and impact more people. But I do want to, just before I forget, because I made a note here because I tend to forget things, give a big shout out to also the people working in the office in Brussels, Beatrice and Bruno, who are working around the clock to make sure that you know, all the stuff in the background takes a lot of work, and so it's thanks to them that things are running smoothly as well.
Well, and another thing, and thank you for that, Kyle. And another thing that's been mentioned repeatedly is the kind of the international aspect of all of this. And one of the questions that we've gotten in from the chat is related to COVID and how that has impacted people's ability to collect as a group. So the question that we received was, with COVID still an issue across the world, what could a young leader realistically consider being able to do outside of their own country? This is a question that one of you would want to jump at.
Yes, I believe that this could be an example of what we could do, because currently on my own island in Aruba, it has been difficult to do projects because of the COVID-19 situation, and let alone traveling is also a challenge. It really depends on your situation, but I could not physically go anywhere now because I decided not to, but I could visit my peers virtually. So that's something that I started the project with. And I just started a month ago, where we speak about our experiences and we share it in our own countries and communities. We really share how we go through diabetes, how it's been with the COVID-19 pandemic situation, what projects we organize and why we organize these projects, and how the program has impacted us as well. So the first person I spoke with is my peer from Mexico. Her name is Diana, and we spoke about our experiences, our diagnosis stories, tips, advice, and she could share that in her community in Mexico, and I could share it in my community, and other people that maybe have a friend, family member, co-student, or an acquaintance that has diabetes could use that useful information and share it. So I'm trying to create more knowledge with the tools that I actually have from the YLD program, and switching things up. Being creative is a huge part of it. I could not organize original project for the children like the monthly camps as planned, because the COVID-19 pandemic just happened right when I was going to start. But we did make a video and shared it on social media in Aruba, a beautiful video with information for parents, for teachers. And I could use social media to share information and participate in platforms like these. This is a huge opportunity, which we have to be grateful for, and hopefully hope that the situation would become later at a later time, and that we could just hold on to all those resources we have, which we were prepared for during the YLD program. We had training in different areas: social media, storytelling, how do you use the tools that you have, and sometimes we have to really work through all the challenges and use the resources that we have at the moment. And one that I was using was my phone, social media, and share the information and talk about it while we hold on to the hope and be positive that we can go back to what we have initially planned and continue making that impact.
I know it's pretty wild that living with diabetes makes us have to sort of be pretty nimble, and COVID has added another layer of necessary nimbleness to everything. So if, it's, at least we're used to having to kind of think quickly and change things up to meet the needs of what's going on in the moment. And Apurva or Kyle, do you have anything you wanted to add to that?
I just have one thing to add. So like Nurian just mentioned that you need to be creative. So like when I joined the program, I applied in 2017. I had no idea in mind, but the Young Leaders program basically provides you sessions on everything. They provide you sessions on how to build up a project. What is a project? Because everybody doesn't know what a project we are talking about. So what is a project? How you could identify the most important needs. So you do a needs assessment in your country. How do you do? What is the important issue you want? You can make a difference. So it basically drills you on identifying that need in your country where you can make a difference. And how do you make a difference? You get the resources by training in particular fields, like how you can use social media, how you can build up a timeline for your project. So it basically lets you, gives you the freedom, it gives you all the toolkits, and it totally depends upon you how you can utilize those toolkits and resources and create a creative project out of it. So I think when I entered in 2017, I went just with a raw idea about, okay, this is the need in my country. There's a youth stigma in my country. I need to fight through that. And then that's how you gradually, through the team at IDF, I would really want to acknowledge Bruno and Beatrice and other people who are involved in the office who kind of like grill you up every month. You need to produce a report. And you're like, okay, you just can't forget that what you signed up for, you will be grilled every month to present a report after every quarter to identify that, okay, you started with a raw idea. Where are you after 1.5 years into the program? And by the time you see yourself after 1.5 years, you've actually intentionally or unintentionally, you've actually created a project, a product which can actually make a difference. So that's how I created a product after being signed up into the program, and just build up a creative side to my needs assessment. So I think that's what I really want to add. And like Nurian mentioned about being creative, so you could just not just build up a project, because I think CWD is already doing camps. So camps is a thing in a developed country, but for me it was never there in a developing country. So for me that was a need in my country, and I built up on that. So you need to be creative. You can use social media, you can use any kind of tools, visual tools, create your own homepage, websites, stuff, and just like go out and just do, because I wouldn't be that creative had I not got the training from the Young Leaders team there. So that's how I would want to just add up that you just build up whatever you have and just identify that need and go out and just get there. Yeah.
I love that. And Kyle, before because we did have another part of a question, did you want to add to that before I jump to the next community question?
No, I think that was great. Let's move on.
Well, the next question we have, again, is a little specific. So we have someone who has asked about the timeline for nominations and the applications for this year specifically. And then there's a second part to it. But let's do the first part of that question first, about application timelines and nominations.
Yeah, and that's a fair question, because as I mentioned in the video, the schedule has kind of been disrupted a little bit. And so we're in the process of finalizing that as far as the next YLD intake, or cohort as we call it. And we'll be making some announcements following probably the Easter holiday, where we'll be sending things out to member associations, as well as communicating via our other communication channels. I've taken the liberty of posting my email on the answer to one of the questions. So for people who may be attending who are interested, please don't hesitate to contact me directly, and we'll make sure and get you the information accordingly.
Bold move in today's internet to put your email right out there. Nice job, Kyle. And then the second part of this question is, how would you say that YLD has helped you become a better advocate, not only through the program with diabetes, but in all aspects of your life? That's a good question.
Yeah. Do you want me to take this question first? Okay, so I will tell you, and I've been talking about this. I wanted to make a difference in the community, and I knew I wanted to be a doctor, but not a doctor just sitting in one particular room and just seeing patients on a daily basis. So I think the YLD program gave me that platform to identify that how I could make a difference, how I could contribute to not just improving lives of other people, but also look within, improving my own life living with diabetes. I fought stigma, I fought isolation, I fought hiding the disease to finally having the courage to talk about it in front of you guys today. So I never had the courage to really go on a platform to share that, oh, hey, I have type 1 diabetes. I couldn't, I was in denial for a very long time. So I think what the question really addresses how it changed my life. It gave me that courage. It gave me that inspiration that, hey, Apura, if you won't talk about it, who else will? Right? So it gave me that courage that I need to make a difference. But how can I make a difference is through working on my inner diabetes, and then helping and giving that hand to somebody else who's still struggling to accept, who's still struggling to fight the denial of the disease. So that was on a personal front. It made me a better person, and each day I'm still learning. Today, when I work with like the global organizations, as I pursue my global health, and I'm working at Jocelyn Diabetes Center, working on like improving lives of people with diabetes, I always see that diabetes is something which gave me this inspiration to continue the fight, because it is so challenging in every country. The challenge is different, but it's still there. Even after 100 years since the discovery of insulin, we are still struggling with access to insulin. Not just access, but also still struggling with the education aspect of insulin. Some people have everything. They have CJMs, they have all the access to tools which they need for diabetes management, but they do not have the support system to make a difference. So I think the challenges in each country are very unique, and that's what makes the diversity of diabetes really a good area to work in. So that's how I got the inspiration, and YLD really gave me that platform to continue the torch which I held in 2017. Yeah.
Well, I love that you have tackled stigma, and not only universally, but personally. I think that's a beautiful thing. And Nurian, how about for you?
Well, I must say that on my island, we speak a lot about diabetes and also other chronic conditions. But at a certain point, the conversation, to which direction do we actually go into the conversation of diabetes? And I really wanted to add to that conversation where we talk about topics that are not nice to talk about, like mental well-being and health and diabetes. The lack of understanding of having a chronic condition when you work, studying, and diabetes. All these things are things that were actually my fuel as well, because I felt that sometimes we speak about the condition, but we don't look deep enough or go deep into what it's actually like every day having this condition. And I'm very grateful because at work, studying, the understanding, it has become more and more, and how we can do that only by educating, informing, sharing, and really holding each other's hands. And in all the pictures of the International Diabetes Federation, I love to see the blue circle in different ways, because it's like when we were very little in kindergarten and we would hold each other's hands when we're going to do something, maybe a prayer or talk about something, or we have to pay attention to the teacher that's going to say something to us. That's how I feel when we are doing this together. We hold each other's hands and we go together, and you feel stronger, you feel empowered. And if we don't do this together, how are we going to move forward to better environments at home, with family, with siblings, with friends at the university, working? And it's understandable. All countries are different. All contexts are different. Cultures. Sometimes you have certain traditions, certain habits. But if we have the tools and the resources and the education, we can go into what will make my life better as a person with diabetes and for someone else. And maybe the little ones that maybe I didn't have that information at the point when I was diagnosed at 20, and I was a bit lost in the beginning, but then I really found my way. We can pave that way for the 5-year-old, the 3-year-old, the 4-year-old. the baby that is starting, so their life could, they could paddle a bit faster and steadier. And that's what it is about, not going fast, but going steady at a good pace and a health pace. And that's what I see in this whole opportunity. It's a life journey, I believe.
And so for all three of you, what makes this program, the YLD program in particular, different from other programs that are available for people who are looking to make a difference? What makes this one stand out, in your unbiased opinions?
I can start, and then I'd love to hear from the two of you as well. I think for me, I was already doing work in the European region in a kind of parallel initiative where we had a young leadership camp, which was more of a one-off event. And one of the sessions that we did every year in this camp was where we would go around the circle in the room and talk about what diabetes supplies and care we had access to in our respective healthcare systems. And even within a region like Europe, there was a vast discrepancy from west to east, from south to north. And the connections that were made, I think, and the light bulbs that kind of went off in the room during that discussion, which ended up going on all sorts of different ways. We ended up talking about discrimination and diabetes in the workplace. That was kind of the starting point. This is what I have access to, was absolutely remarkable. And I feel like the global program does that to an order of magnitude, really, because there are such vast differences, as has been mentioned, in our countries. When we have 90 active YLDs, mentors and trainees from 35 different countries, there are remarkably different cultures and languages and perhaps barriers for people living with diabetes. So that opportunity to learn from one another, kind of a best practices. We heard one example about camps. So camps, may be a lot easier to do in a country with resources, but countries finding ways to do them nevertheless, and understanding what the kind of basic principles are. Just one example, and maybe another example that really has always stayed with me in one of the more recent camps in the European region. And again, I'm drawing a parallel between the two because I think there are some similarities. We had a member that was participating in a camp from a Scandinavian country that had access to a healthcare system that provided just about everything that she needed. And she was sitting in this particular exercise that I described, where we were describing what supplies we had access to, glucometers, to CGMs, to pumps, to some of the more basic things, syringes, insulin. And she was sitting next to someone from Eastern Europe who had very little access. And she was so incredibly struck by this connection that when she went home, she started to write articles about it and educate her fellow countrymen and women about, this is what's going on in our region. These people, don't have access to what we have. How can we complain about, the type of and model of insulin pump we have when these people don't necessarily, our neighbors have access to what they need for basic diabetes care. So those types of connections, I think, are what makes this program particularly powerful because of its international nature.
Yes, thank you, Kyle. And Nurian, or I didn't know who wanted to jump in next on that one. It can't be me. I'm the only one who hasn't gone through the program. So that's the last. It just can't be me.
Do you want to go, Nurian, or should I go?
I was struggling a little with the button because I had like a window there and I couldn't press on the unmute button. You could go ahead.
Oh, so just resonating from what just Kyle mentioned, that the international, the nature of the program is actually what interested me to apply for it. And so I was just a normal person, right? I wasn't searching for an organization, and some of the photos which I saw on the website of people who had applied to the program for YLD in 2013 and 15, like that. So because I'm a very global kind of a person. I really like the flags in a particular room. I think that was my interesting fact. I want to be in that room, which has like so many flags from across the globe. And I want to just see how it feels to live with type 1 diabetes in Syria. How does it feel to live with type 1 diabetes in America? So I wanted to know. I was very inquisitive to understand the challenges which people were facing, individual challenges. And that's what intrigued me to like apply for this program, because I could see only the four walls of diabetes in India, because I knew that there's stigma I'm struggling with because this is a challenge in India. But I never knew that there are also certain humanitarian aspects, challenges, which people from Syria or people from the Middle East have been facing. So I got to see different sides of diabetes in that particular room when we all created a family. So like you don't just create friends, you create a family of people living with type 1 diabetes across seas and across nations. So I think that's what was the most inspiring moment for me, and that's what was the reason why I applied for this program. Yeah.
Can I jump in on this? Because Apurva said something that I remember something when I was diagnosed in 2015. That was in June. I was finishing my internship and I had to move things around, and then I started my last year. And that same year in December, I started looking around, and I was looking at global platforms because I was interested in. And that's why I connect on that level, because I was curious to see like what other opportunities are there on the island and outside of the island. So I saw International Diabetes Federation, but I never noticed Young Leader in Diabetes. I didn't know that it existed. So I think I never clicked on that tab and I didn't see it. So I just left it, and then I continued following International Diabetes Federation. And when I got to participate and apply in YLD, I noticed that participating in this program, it really means that you are committed to lifelong learning as well. Because if you're curious or inquisitive, as Apurva said, you are going to be eager to learn more. I believe that the world has become small in a way, thanks to technology and social media, and we could be far from each other, but yet so close. And that's what makes it an amazing program as well, because even though we could live in different contexts and cultures, there's some things that we're going to learn from each other. And at a certain point, some of us travel, we leave our island or our country to study abroad. And it's important for you as an advocate to understand different people. And that's one of the reasons as well that I think it's great when, for just an example, you could speak more than one language and you can speak to someone else when you go to another country. You communicate with the person. And that this program, it inspired me so much that I wanted, and I still want to learn sign language, for example. And I just imagine like, how would it be being able to communicate with other people in another language, because I want to be understood and understand someone else. And this program has just it sparked that fire. It fuels you to want to learn more and do more, and just go not an extra mile, but just 10 extra miles, I would say, for the community of diabetes, because you know that you're not the only one in this situation of having this condition, but there's a lot more people out there in your country or around, and social media has made it so small that anybody could follow you. You'd never know what impact or influence you could have on someone else that maybe just saw that one tip that you added and it changed their whole life because of that one tip. And never again you're going to be unaware of the impact that you can make on someone else's life. Thanks to YLD program as well for that experience.
I love the idea that it's inspired you to go 10 extra miles. That's a really powerful statement. And also I'm hoping that the one tip that someone can get from this discussion is to be inspired to apply for this program. So I posted a link in the chat, which I'm hoping, Kyle, is the right link. If you don't mind, so that's the right link. So if people are looking to get more information, they can click on that link. Unfortunately, we have a minute left of this chat, and I didn't realize because it went by so quickly. And thank you so much for sharing all of your stories. But in our last minute left, is there anything that we would want to add? Is there anything you want to make sure that you share with the children with diabetes community? And just to add that we are very, very grateful for your participation tonight.
I would just say thank you to CWD again for including us in your series. we, we are big believers in collaborating with others doing work in the diabetes world, and our organization has really created a model, as I mentioned, in so many different ways of collaborating and teaching and bringing people together with diabetes. And so I think there are a lot of synergies there. And I would encourage anyone who is attending, who is interested in our program, please reach out to us. If you have questions, please apply. And for others who may be doing work with their own organizations, please contact us if you're interested. We'd love to work together and learn more about what you're doing.
And Nurian or Apurva, do you have anything you'd like to add as we close out?
I just want to comment upon what just came in the chat from Johanna, who was one of the very strong, powerful YLD program advocates. She mentions about that through this program, you just, it's not just for a few days that you will forget like as a training, but you will create friendships and relationships forever, for a lifetime, and you'll be continuously forming that relationship. Despite the fact wherever you move in the world, you will know that yes, you were a YLD, and then you have somebody in that particular country or like far away. And just last statement, I would, if you get selected from your country for the program, don't forget your flag, please, because that feeling of putting your flag on the wall is amazing, and it's beyond, like, you can't just feel it right now, but when you put it, you feel like, oh my God, I'm here already. You need to pinch yourself then.
I hope for your upcoming birthday that someone gets you a giant room full of flags. Like, it just seems like it's a thing that needs to happen for you. And
I love the colors. I love the colors of the flags.
Sorry, Nurian, did you have something you wanted to add to?
I agree with what Apurva said. When I saw my flag, because Aruba, many times we're very small on the map. It's like a dot, maybe not even a dot. It's very small. If you look at a map, you'll see what I mean. So when I saw the flag on the wall, it's just an amazing feeling being part of this community. I just wanted to say that if you have diabetes yourself, a friend, colleague, child, anybody around you, think about the diagnosis as an opportunity, an open door for new opportunities. It's not the end of a life that you had, but it's the beginning of a new one. And never be afraid to start on a new journey. And if joining YLD is one of them, don't be afraid to join, and you'll be on a amazing journey from now to your whole life. It will never end. It's a beautiful one with a lot of rainbows, butterflies, and a lot of colors. Of course, challenges, but it's going to be amazing.
I absolutely love ending on the note of a diagnosis being an opportunity. So, oh, Kyle's already left. So I guess the chat's over, but oh no, he's back. Oh, there we go. We've got some flags. So as we close things out, I want to thank the three of you for joining us tonight. I'm really grateful for you spending your time with us and being so generous with your perspectives and sharing with our audience. And for everybody at home, thank you very much for spending another Sunday evening with us for a CWD Screenside chat. And we will be back in 2 weeks at 7 p.m. Eastern with another discussion. So we'd love to have you join us. And you can get more information at cwd.is/Screenside. But for now, we're just going to be waving our flags and saying goodbye. So thank you to everyone for joining us, and we'll see you next time. Thanks, everybody.
Thank you.